Come in.
Hi, my name's Emily Langlinais. I'm a PA student. I'll be helping you today. I'm gonna wash my hands. I'm gonna write a few things down and then we're gonna get started, okay? Okay, let's go ahead and get started. So what brings you in today?
I'm urinating blood.
I'm sorry to hear that. When did this begin?
Yesterday.
And since it began yesterday, has it been every time you've used the restroom?
Yep.
And can you tell me, like, is it completely red or is it just spots of blood?
It's spotty.
Are you having any other associated symptoms?
No.
Do you find anything makes it worse or better? Like drinking more or less, or
Yeah, I don't drink a lot.
does that make it better or worse?
Worse.
And have you found since it began yesterday, has it gotten worse or better? Or has it not changed?
It hasn't changed.
And on a scale of 0 to 10, would you rate it how would you rate the amount of blood on a scale of 0 to 10?
Like
The severity?
a 4.
A 4. And have you ever experienced this before?
No.
Okay, now I'm going to ask you some general questions. These you can answer yes or no to. Have you had any fever?
No.
No. Have you noticed any chills?
No.
Any unusual fatigue?
No.
Have you had any general discomfort or feeling of unwell?
No.
Any generalized weakness?
Mm-mm.
No. Have you had any recent appetite or weight changes?
No.
No. Okay, now I'm going to ask you some questions specific to your urinary system. These you can also answer yes or no to. Have you had any pain in your mid to lower abdomen?
No.
In your pubic area? No.
No.
Have you had any discomfort when urinating? Any pain?
No. I'm not got a little tingle.
Have you had any changes in your urinary stream? Have you noticed
I haven't noticed.
Have you noticed any changes in the color of your urinary stream?
Yeah, red.
Have you had any penile discharge?
Yes.
Can you tell me a little bit more about that? Is it
It's just like off and on.
off and on? When did this begin?
Yesterday.
Yesterday. So has the discharge, is it the blood you're referring to, or is it something else?
Yeah, it's a little bit of blood.
Any other discharge?
It's like thick. I don't know.
Bloody and thick. Okay. Have you had any swelling of the face?
No.
Have you felt like you're frequently going to the restroom more than
yeah.
usual? And have you had any blood in the urine?
Yeah.
Have you felt like when you go to the restroom you're hesitating? Is it
No.
no?
Mm-mm.
And have you had any incontinence, any loss of control over urinating?
No. Not for, no.
Have you had any erectile dysfunction?
No.
Have you been frequently waking up during the night to use the restroom?
No.
No. Have you had any like decreased volume of your urine? Have you noticed it's been less than usual?
No.
No. Have you had any excessive urination?
No.
No. And have you felt like when you go to the restroom, it's urgent, like you have to go right away when that feeling comes on?
No, not really.
No. Okay. Now I'm going to ask you some specific medical history of yours. I'm going to ask you about 7 specific conditions, and I want you to tell me if you've ever been diagnosed with these or if you currently have any of these, okay?
Okay.
Any high blood pressure?
No.
Any diabetes?
No.
Any high cholesterol?
No.
Any coronary artery disease? Heart disease?
No.
Any heart attack?
Nope.
Any stroke?
Nope.
And have you ever been diagnosed with cancer?
Nope.
No. Have you ever been hospitalized?
Nope.
Have you ever had any surgeries?
Nope.
Are you up to date on all your immunizations?
Yep.
When was your last flu shot?
December of 2015.
Okay. Do you take any prescription medications?
No.
Do you take any over-the-counter medications?
No. Natural.
Do you take any vitamins or supplements?
Vitamins.
What vitamins do you take?
Vitamin C
Vitamin C. How often do you take that?
every day.
How many do you typically take in a day?
1 dose.
1 dose. Do you know the dosage?
No.
No? Okay. That's okay. And do you have any drug allergies?
No.
Any food allergies? Any
No.
environmental allergies?
Nope.
No. Okay. Now we'll move on to family history. Are your parents living?
Yes.
Both mom and dad?
Yes.
Can you tell me their ages?
50.
Are they both 50?
Yes.
Do you have any siblings?
No.
Do you have any children?
No.
I'm going to ask you those same 7 conditions we talked about in your past medical history, but these pertaining to your parents. If either one of these have ever been diagnosed with these or if they currently have these, you can just say yes, okay?
Okay.
Any high cholesterol?
No.
Any diabetes?
Nope.
Any high blood pressure?
Nope.
Any cardiovascular disease? Any heart disease?
Nope.
Any heart attack?
Nope.
Anyone ever have a stroke?
Nope.
Anyone diagnosed with cancer?
No.
No. Okay, now I'm going to ask you some social history. Do you currently use tobacco products?
No.
Have you ever used tobacco products?
Yes.
When was the last time you used tobacco products?
December 2015.
Which tobacco products have you previously used?
Dip.
Okay. Do you currently drink alcohol?
Yes.
How often do you drink?
Once a week.
How many drinks do you typically have at a time?
1.
Okay. Do you use any illicit drugs?
No.
Have you ever used illicit drugs?
No.
Can you tell me a little bit about your diet?
It's pretty healthy.
Pretty healthy. What do you typically eat for breakfast?
Eggs.
What about lunch?
Chicken.
Just chicken?
Chicken and rice. And broccoli.
And what do you typically eat for dinner?
Chicken, rice, and broccoli.
Can you tell me about any exercise that you do?
Yeah, I go to the gym
How often do you go to the gym?
5 days a week.
Okay. Can you tell me about your living situation, who you live with?
Single. Live by myself.
You're single. And alone. Are you currently employed?
Yes.
Where do you work at?
A Greco.
Do you have an office job? Is it a...
Yep. Office job.
And can you tell me a little bit about your finances? Do you have insurance?
Yes.
And are you able to afford your medication?
Yeah.
And are you sexually active?
No.
Okay. Just to reiterate, I'll kind of summarize everything we went over earlier. So yesterday you started having some blood in your urine. It's every time you use the bathroom, it's a little bit spotty. And when you don't drink a lot, it does make it worse. It hasn't changed since it began. You rated it as a 4 out of 10 severity wise, and you haven't experienced this before. And it does tingle a little bit when you're urinating. The color is red. You are having a little bit of penile discharge. It's been on and off since yesterday. It's bloody and it's thick, and you have had some frequency and some blood in the urine, correct?
Yes.
Okay. All right. Well, that was it. I'm going to wash my hands, and I was just practicing taking history today, so thank you so much for your time.
Thank you.